Whenever taking a history of a spinal patient, I would consider red flag signs, which are loss of power, non-mechanical symptoms, nocturnal pain, bladder and bowel dysfunctions, thoracic pain, weight loss, fever, and history of malignancy or myelosuppression. Regarding the history, I will take a elaborative history regarding history of present illness, chief complaints, and past history, and would take an action finding the character of the pain, onset, site, character, radiation, intensity, relieving and exacerbating factors, and any neurology associated. Regarding the radiculopathy, the patient would have a sharp pain which should be radicular and should be of a dermatological pattern. The patient can have neurological claudication as well. In a myelopathic patient, it will be non-dermatological pain, tingling sensations, and will be difficulty with dexterity. When I examine a patient, I will expose the patient, look from the front, check for the shoulder level, check for the scapular spine, alignment of the spine and the head. I will check for any axillary freckles or any skin marks or cafe au lait spot itself. I will check for any hair tufts which is visible. On the side, I would assess the curvature of the spine, which will help me to have a sagittal balance. I will check for flexion deformity of the hips and check if the patient have a flat back syndrome. That is, the lordosis is reduced or either exaggerated. Moreover, while examining the patient, I will look for any. I will check for the symmetry. I will mark a plumb line which should be pointing towards C7 till T1, and will check the balance. I will make him forward and do an Adam test. If there is a scoliosis, I will feel a bump on the side of the convexity. I will feel for the spinous process of the spine of the back at the back and check for any step off. I will check the paraspinal muscles. Regarding further assessment, I will move the cervical spine, which consists of flexion, extension, lateral flexion, and rotation. Regarding the lumbar spine, I will ask the patient to move forward and check the distance, which is the distance which is measured by putting a mark on the back, and we'll check the extension of the lumbar back. Regarding further assessment, I will make the patient supine and will assess the patient regarding cervical spine, lumbar spine, thoracic spine, and will do the examination as properly indicated.